Hi, I'm Michelle Grazoulis, and I'm president of the foundations at Rochester Regional Health, and I'm here for this week's Facebook Live chat with Dr. Mahta Mortezavi. Welcome.
Thank you so
Glad
much
you're here.
for having me.
Dr. Mortezavi is an allergist at Rochester Regional Health, and we thought because it is the season, we would talk about allergies. So let's start with a really easy, simple question. Why'd you get into allergies?
Well, when we go through medical training, we get to rotate through the different specialties, and during my allergy immunology rotation, I knew immediately that this was the field for me.
What was it? What happened to you where you were like, this is it?
I think it's part of it is that I love immunology, and the other is that I felt a close personal connection. I have a lot of family members with food allergies and eczema, and I personally have really bad environmental allergies and asthma myself. So I think it was that personal connection that made me really have empathy for patients and understand the impact that it can have on their quality of life.
Yeah, I'm going to jump ahead because I find this really interesting. As preparing for this, I was so interested. I never made the connection that it really is about an immunotherapy or an immune resistance issue, right? So explain that to our listeners, like sort of how do allergies begin in somebody physiologically or biologically?
Sure. I mean, my patients have heard me say this a million times, but essentially the job of the immune system is to fight viruses and bacteria. So if the immune system starts to make mistakes, just like us, our immune system's not perfect. Yeah. So if you start to make antibodies to proteins that are usually benign, then you get allergies. So, for example, making antibodies to food proteins is the cause of food allergies, and likewise, if you start to make abnormal antibodies to pollen, cat and dog dander, things like that, then you start to have allergic reactions to the environmental allergens.
So environmental allergens are considered proteins too?
They are, yep.
I didn't know that.
Yep.
Interesting. Mm-hmm. That's fascinating to me because I have suffered from allergies my whole life and asthma, and you kind of wonder how all of that gets lumped together. Our bodies are amazing. So we're going to come back to that. But let's first start with, you talked a little bit about it, but what causes an allergy? It's an immunotherapy response? Okay.
Yeah, so it's an abnormal immune response. And why they happen and why they're on the rise is a hot topic. So both food allergies and environmental allergies are on the rise. The old teaching was that adults never acquired new environmental allergies, and that's no longer true because we see adults who didn't have allergies as children and come in with legitimate symptoms and positive testing all the time.
Why is that happening, do you think?
I'm going to come back to that,
okay,
but I wanted to also mention that food allergies are the other thing that's really on the rise, to the point where now 1 in every about 13 children, which is an estimate of about 2 kids in every single classroom who have food allergies. So why is this happening? I mean, again, we don't know for sure, but the studies seem to suggest that everything starts very early on. Yeah. So there are studies showing that in utero exposure to maternal cigarette smoke can make children more prone to allergic rhinitis and asthma. And then how you're born also matters.
Yeah, that was fascinating to me. And tell everyone that, because that I was shocked by.
Yeah, so they've compared C-sections with vaginal deliveries, and there is an increased risk of allergies with C-sections. And the question is why? Yeah. So if anyone who's a parent or has witnessed a birth knows that vaginal deliveries are not sterile as opposed to C-sections, which are a surgical procedure. So the theory is that it has to do with that environmental exposure as you're coming through the birth canal.
You develop a resistance based on being exposed to it?
It's the bugs, so we need to be exposed to bacteria. We were not intended to live in a sterile environment. So essentially, allergies happen because we're too clean.
Yeah, I was just going to say, there's that old, everyone always says with antibacterial soap and the overusage of that and hand sanitizers that we're really doing ourselves a disservice to a certain extent because we're not allowing ourselves to develop the natural resistance. And it would follow what you've just said, which is really interesting.
Yeah, some of the other really interesting data that's come out really internationally is comparing city children with kids who grow up on farms. And they've found that exposure to farm animals is actually protective. So I don't know how we bring that to city children, but it seems like the kind of the variety of bacterial exposure is a protective factor.
Well, it's also, I think about my own experience too. I grew up with a dog and had asthma and would go over to someone else's house and react to their dog, but not react to my dog because I grew up with my dog, right? So I was used to his dander and sort of became immune to it. So it's really interesting when you think about that. So let's talk a little bit about what are the most common allergies that you see people for?
So I guess let's separate environmental allergies and foods. As far as environmental allergies are concerned, they really vary by area. So if you see an allergist in Rochester, the testing that you'll have done is different than the testing you'd have done in Florida, because what grows here is different than what grows down there. So the most common allergens up here are, the pets, like you mentioned, cat and dog, mice and roach, as well as dust mites. So those are kind of the perennial allergens, or things that can affect you all year round. And then we have the seasonal fun. So in the spring, we have the trees pollinating. In the summer, right now, the grasses pollinate. So a lot of patients are suffering from that. And then starting kind of in August until the first frost is when the weeds pollinate.
So it's the pollination that that's the bacteria that we react to, right? It's not the physical
protein,
blade of grass.
yes.
Yes. Okay, so that's why other times you can be around it and it's not bothering you, but it's that period of time where it's active.
Yeah, and what I really love is, people come in all the time and say the cottonwood is killing me, and that stuff is really visible, but actually completely innocent. So it's the things that you don't see that cause the reaction. So grass pollen happens to happen at the exact same time that those guys are floating in the air. So it's actually the grass.
They get a bad rap.
Yes.
I'm going to pause for a quick second and check in with Phil to see if there's any questions.
Talk about Christmas trees too. They're kind of similar in that light, right?
Sure, yeah. So, it's the same thing. A lot of people think that they have an allergic reaction to the Christmas tree, but it's actually the mold that's covering the natural trees.
Interesting.
Yeah.
Okay, let's talk about treatment. So those are the environmental allergies and we didn't talk about food allergies. What are the most common food allergies that you see?
Thank you for reminding me.
No problem.
So as far as food allergies are concerned, what we see with adults and children are completely different. So in children, the most common food allergy is cow's milk, which affects about 2.5% of infants and young children, and then egg white, which is about 1.5%.
Okay.
And then the one that gets probably the most attention, peanut, which affects 1% of all children, which is a lot of kids. And then we have the other common allergens, which include tree nuts, soy, wheat, and most recently an emerging allergen is sesame, which we're exposed to more and more because it's one of the ingredients in hummus.
Yeah.
So
and people are eating hummus more and more. I want to ask a few more questions about the peanut allergies because that's a huge one, and I know just from having my kids go through school, they're much older now, but the warnings. So a peanut allergy seems to be, to me, as I've grown up, a much riskier allergy because of obviously, a deathly reaction on behalf of the person who has it. Same thing with eggs and dairy. Can the reaction be the anaphylactic sort of asthmatic reaction be the same?
It can. Yeah.
Okay.
Yeah.
So it's that's really interesting. I don't know that people think of it. And is the incident in peanut allergies increasing as a result of sort of by changes in the way people are reacting, or is it just that we're able to diagnose it differently? It's kind of like that. When I was little, I'm sure there were kids allergic to peanuts, but we didn't.
Well, no, I think that when we were kids, I just don't think that there were that many food allergic children in our classrooms. So when they looked at the actual numbers between 1997 and 2011, the rate of food allergies has gone up 50%.
Wow.
So it's not an imagined
increase.
Rate, it's objective, and we see more and more of it.
Wow.
Yeah.
That's amazing.
Yeah.
So let's talk about treatment. So what are treatment options for people? What do you typically prescribe as a protocol for treatment?
Sure. So let's focus on food allergies since we were just talking about it. So, traditionally, testing to know exactly what you're allergic to is probably the most important first step.
Okay.
And that's done very easily in our office with a quick scratch that takes about 15 or 20 minutes. Yep. And then sometimes we send our patients for blood work as well, so we can objectively measure the level of the abnormal antibody that they are making.
Okay.
And that's useful because we can follow that over time, and then we can provide the families with information about are things getting better, worse? What should we do next?
Okay.
So in terms of treatment, the traditional recommendation for food allergies has been avoidance for the most part, and then carrying an EpiPen. But it is a very hot topic, and I think all of our food allergy parents are very much in the loop with the recent developments, especially in the peanut allergy world.
Yeah.
So there are several products coming out now, some of them oral and some of them patches, that are in study to try and increase the dose needed for exposure before a reaction happens. So it's not quite a cure, but I think it's a great step in that direction.
Is it, sorry, I'm going to ask a
Sure.
layperson's question
No,
just to
go
understand
ahead.
that a little bit more.
Yeah.
Is that about exposing the person who's allergic to a little, and I'm going to use simple
yeah.
words, expose them to a little bit of what they're allergic to, the peanuts, right?
Yeah.
To build up some resistance so that they end up not having as strong a reaction to a small exposure? Is that kind of the idea?
Exactly, yeah.
Okay.
So, ideally, we would want to come up with a treatment that makes the peanut allergy go away altogether.
Yeah.
We're not quite there yet,
Yeah.
but the studies are looking at getting the children to ingest increasing amounts of peanuts so that, for example, they can eat 2 or 3 peanuts a day and not have a reaction. And I think that's very important, especially if you have a child who's going away to college,
Yeah,
let's
I
say,
know.
and you know that they are not going to necessarily sit there and eat, a spoonful of peanut butter, but they're not in a controlled environment where the parents can necessarily
Make sure
monitor.
that there isn't,
Exactly. So
Yeah.
I think it is reassuring for a lot of parents.
Oh yeah, my mother developed a peanut allergy at over 60 years old,
Wow.
which was just so unusual. And I think about how that shifts everything that you're used to eating because of exposure, cross-contamination, if you will. Okay, so that's that's the typical treatment. Talk about the over-the-counter things that people use to treat environmental allergies.
Sure, yeah.
And do they work, and what should people know?
So there are a number of excellent antihistamines that I'm sure a lot of our patients and viewers are familiar with. Most of them are over the counter now. And then there's nasal sprays as well. So, if you have itchy, runny nose or eyes, usually taking an antihistamine can make the symptoms less severe. But as most allergic people know, it doesn't make your allergies go away, and you have to keep taking a dose every day in order to survive, right?
Yeah.
So the only treatment that we have that can make allergies less severe, and in some cases actually make the allergies completely resolve, is allergy immunotherapy.
Yeah.
So this kind of goes back to what we were talking about at the beginning, where your immune system is producing a faulty protein. So the idea of allergy immunotherapy is to re-educate the immune system through repeated exposure to the very thing that you're allergic to.
Yeah, it's amazing.
Yeah. So it really is one of the most organic treatments there is in medicine. The mix is purified version of the pollens and the dander and the things that you're allergic to, and it is customized to each patient based on their skin testing.
Yeah, that's fascinating.
Yeah.
I've taken allergy shots, and
So
it's
you're-
amazing. But
yeah.
I haven't for years. I stopped when I got pregnant.
Yeah.
But it is amazing how they work.
I'm very candid with my patients about my own experience. I'm like the classic allergic kid who had sinus infections all the time, and I finally
That explains why you became an allergist.
well, there you go, right? And I finally gave in and had my one of my partners is actually my allergist, Dr. Mustafa. So he tested me, and I went on allergy shots, and it's been a life-changing experience.
Yeah.
It really, really has.
It does
helped.
make a difference. It really does make a difference.
Yeah.
So I want to ask a couple questions about
Sure,
things
sure.
that you mentioned peanuts, obviously.
Yeah.
But bees, people are definitely allergic to bees as well, and
Mm-hmm.
it's obviously not the serum, whatever it's
It's the sting, yeah.
Thank you, the stinger. There's not much that you can do except for making people aware of the fact that
Mm-hmm.
they're allergic to bees, right? But treatment, if someone is allergic, they need to seek treatment immediately. Anything else that you'd want to elaborate on with bees?
Everybody kind of blames bees, and people who do have allergies to honeybees do tend to have more severe reactions. But people, including allergists, including all doctors, are notoriously terrible at identifying insects. So just because you think it was a honeybee doesn't mean it wasn't a yellow jacket or a wasp. So when patients come in and tell us that they had a systemic reaction to a sting, then we do testing to all of those insects to find out exactly what the reaction was to. And we take a lot of time actually getting a specific history on what happened. Because obviously the stinger is the protective mechanism for the insect. So sometimes, you get stung and you get a big swollen area, but it's just that little area. Obviously that hurts a lot and you're probably not going to feel great. But that's kind of that's like what's supposed to happen. But if you have any other symptoms, so if you, let's say, have this swelling, but then you develop body-wide hives and you have shortness of breath, or you have GI symptoms like nausea, vomiting, diarrhea, so it seems like there's much
something
more going on, then those are patients that should definitely have an EpiPen, see an allergist, and again, going back to immunotherapy, doing immunotherapy can reduce the risk of an anaphylactic reaction to venom from 60 or 70% down to 3%.
Wow.
So it's very, very effective and can be life-saving.
Say that again for everyone listening, because that to me is significant.
Yeah, so if a patient has had an anaphylactic reaction to a stinging insect in the past, then the risk of them having an anaphylactic reaction on being stung again is about 60 or 70%. But if they receive allergy immunotherapy and are desensitized to the venom, then the risk goes down to 3 to 5%.
That's amazing.
Yeah.
If I had a child with that, I would want to pursue that.
Right.
I want to ask a question too that I think people often wonder: are allergies inherited or developed, or both?
So, that goes a little bit back to what we were talking about, all the environmental factors. So, but we do see a clustering of allergies in families. So, usually it's like a mom or dad who had environmental allergies and their kids inherit it. But some of the most interesting data actually comes from looking at immigrants. So in general, when you look at the developed world versus the developing world, allergies are a Western problem.
Really?
Yeah. But when you take, children from those same ethnic backgrounds in the developing countries and you move them to the Western world, their risk of allergies is the same as the people growing up here.
So interesting.
So it almost seems like it's more environment than genetics.
Yeah. And this just popped into my head as well. Is asthma, I know that asthma is often a reaction to a manifestation of an allergic reaction to something, but are they always tied together, or can people have asthma but not have any allergies?
Mm-hmm. That's a great question, and so classically asthma, eczema, and environmental allergies are kind of the trio that travel together. But now more and more we're finding that not all asthma is created equal. So there are certainly patients who have environmental triggers for their asthma, but there are also people who have completely different types of asthma that don't necessarily have environmental allergies.
Okay, interesting. Do people grow out of allergies?
So that's a great question as well. So let's look at food allergies first. I mentioned to you that cow's milk and egg are the most common, but they have the best prognosis. So most children actually grow out of milk and egg allergies. So you see very few teenagers and adults with it.
Interesting.
Yeah. Peanut and tree nut are less likely. So there's about a 20% chance of growing out of those.
Interesting.
So it's not amazing, but we do see people who grow out of them.
And that's growing out of it without the immunotherapy support, right? So there's, because that would accelerate. I would think that the immunotherapy would accelerate the growing out of. When in reality, it's the medicine that's actually helping you develop the
But I mean,
tolerance.
not to get too nitty gritty, but going to the milk and egg allergies. So there is a little bit more nuance even there. So you can be unable to tolerate any egg at all, or sometimes children get to a point where they can tolerate trace amounts of egg if it's baked to a really high temperature, and the same with milk. And they have found that children who are able to tolerate the baked egg and baked milk grow out of their milk and egg allergy faster. So there's even that kind of works like immunotherapy in itself.
Well, and it's you describing it as actually the protein that we're allergic to shifts. For me, it shifts the way I think about it, because it's knowing that you're actually allergic to a protein and not sort of the nebulous egg, because egg whites are pure protein.
Yes.
Right? So now I understand that. It really helps you help me understand it. I don't know about the audience.
Specifically to cats, can you grow out an allergy to a cat?
Can you grow out of it? So I wanted to, actually, that's a great question, because I wanted to talk about environmental allergies. So the chances of growing out of environmental allergies are not amazing. So allergy immunotherapy is your best bet. And before I forget, in addition to the injectable allergy shots, if you will, that we have available, there are now 3 FDA-approved sublingual products as well. Unfortunately, cat is not one of them. But
describe for the listeners what sublingual means.
Sure. So you've gone through allergy shots, so usually what we do is we make a serum that's a mix specific to you, and then we start with a very dilute version and slowly introduce a stronger and stronger dose until you get to a top dose, and then you come in once a month and get your shot. Some patients can't afford that with their schedule. Some patients don't like shots. So, the alternative now is the sublingual, which means that it's like a little tablet that you put under your tongue. So it's available for dust mites, ragweed, and grass.
Interesting.
So far, yeah. So the dust mite tablet you would have to put under your tongue every day all year. So it does take some discipline, but it's a matter of preference for the patient. So we do offer both options. And then for the grass and ragweed, you take it 6 weeks before the pollen season and then through the pollen season, and then you stop and then do the same thing next year. And the results have been found to be similar between the 2 types of immunotherapy.
Interesting. So no on your cats.
Not for cats, no. But I think sublingual immunotherapy is a hot topic.
Well,
and I wouldn't be surprised if that becomes available within the next few years.
It's so interesting. I want to stop and ask Phil any other questions that are coming in.
I mean, without being too like Target brand or like CVS brand versus Claritin and Zyrtec.
Okay, so do the generics have an advantage, disadvantage to the name brands?
Oh, I don't think so. I think if you have allergies, you need to have your medication every day. So I go with the cheapest. That's my recommendation to my patients.
And the thing that I know I've been asked, and I've said this to my kids too, is I always get confused, is it either the generic or the name brand of Zyrtec or Claritin? Which one makes you sleepier? Right, because they're different.
So
Zyrtec or Claritin,
so let me go through all the antihistamines, maybe.
Yeah, we'll do that.
So there is the
She's
famous.
the doctor, we're not.
No, get that. So there's the Benadryl, which is diphenhydramine, and that's the most kind of sleep-inducing one. And
I can't take that.
It's not my favorite for people who have the need for an antihistamine every day, especially because you need to function. I want my patients to be able to drive to work safely or go to school.
Stay awake.
Yeah, exactly. So that's not a great antihistamine. And the other thing with it is that if you're taking it chronically, it only works for probably a few hours. Yeah. So it's not a great sustained treatment. Okay. Loratadine, which is Claritin.
That's what I was trying to remember.
Is a good antihistamine. Okay. It is not as strong as the other 2, which is usually my go-to, which are cetirizine and fexofenadine, the brand name being Zyrtec and Allegra. So those 2 are pretty well tolerated by the majority of people, and almost nobody feels sleepy on them.
Okay.
Yeah.
That's really helpful, because I think for most people listening, that's,
Yeah.
that would be helpful. Is there anything that I haven't asked you about that you think, for sort of a primer on allergies, you would want to share with the audience?
Yeah, for sure. So there are actually 2 things on prevention that I really wanted to come back to. I'm so excited that in the last few years, 10 years or so, there's been a big focus on breastfeeding. So that is an important movement.
Absolutely.
And there is evidence that breastfeeding children does reduce the risk of allergies.
Because, I mean, I think I know from having breastfed my kids too, but
Yeah.
explain to everybody why is that? Because in the milk passes.
I mean, it's probably a couple of different reasons. One is that, again, breastfeeding is not sterile, so there's probably a little bit of that exposure, but also there are antibodies in the breast milk that protect the GI tract. And, breastfeeding is hard. And if you're a working mom, it's hard. But even if you do it for a few months, it's...
Every little bit helps.
Anything that you can do is a gift to your baby.
Is the research out there, I'm curious, is the research regarding breastfeeding focused probably more on food allergies because of the protein component versus
mostly
versus environmental? I would think.
Yeah,
I would think. Okay, so that was one of the two things you wanted to mention, and then the other.
Yeah, and then the other one is a hot topic is on peanut introduction.
Yeah.
So in the old days they used to say, wait to introduce the allergenic foods, wait till the first birthday. And we didn't really have a good study to guide us, right? That was just kind of the presumed right thing to do. And thankfully, a couple of years ago, an amazing study came out of Europe looking at high-risk children, so kids who already had eczema, who already had egg allergies, and asking, would we be doing them a favor and introducing peanut earlier rather than later?
Interesting.
And when they actually studied that, they found that it was much better to introduce the peanuts early.
Wow.
Yeah, so the risk of having a peanut allergy was dramatically lower for children who were introduced to peanut between 4 and 6 months of age.
That's really interesting.
Yeah.
And as you were talking, I was thinking too, one of the things I think that might be helpful too is for new parents, I think there's always the concern over you mentioned it, when do I introduce something? So of course they should check with pediatricians first and foremost, right? But when should somebody become concerned? When is it that you say, oh, this is more than just they don't like it, this is actually a reaction? Hives are easy to see, but are there other things that people can look for?
Well, let me kind of answer your question in a roundabout way.
Okay.
I'm a mother of a 19-month-old little boy and first-time mom, and it is a scary, nerve-wracking situation. And presumably, I should know things, but when it's your own kid, it is very scary. So I think the pediatrician is the primary partner for the parents, but the allergist is kind of like the backup. So if the parents have any reservations about introducing the peanut, whether it's a personal history, whether it's just anxiety, or one of their older children having a peanut allergy, we are happy to see people and actually do testing to kind of reassure them. And then the second thing that we do very frequently is to do introductions in our office.
Oh, that's great.
Yeah, so you're not alone
great.
as a parent. We're definitely there to help people through this.
I think that's really helpful and comforting, because I do think what you said is true, is being a parent's anxiety inducing regardless,
sure.
and then to think about all of these things can be scary, and so to make it less scary is really helpful. Really helpful. So I always love to ask this question.
Sure.
I think I know why you chose allergies.
Yeah.
But why did you choose to become a doctor?
Well, I come from a family of all artists, so I'm kind of like the
You're
outlier.
the gypsy who went a different direction.
Absolutely. I loved science from an early age, and I also love taking care of people and getting to know my patients over time, seeing little kids grow up, and being a doctor is the dream because I get to use the latest science to take care of people. Yeah. So I'm very lucky.
It's a puzzle, really. When I listen to you educate me about allergies and these issues, it really is sort of looking at a number of things, and I would think it would be very interesting to do.
It's amazing.
Phil, do we have any questions? We're all set. So I want to thank you for being here.
So much
it's really
for
nice to get to
having
know
me.
you and to talk about allergies. And I ask anyone listening who has questions, please submit them, and we'll attempt to get you answers. And Dr. Mortezavi, thank you very much.
Thank you so much.
Appreciate it.
Thanks.